Begin a relaxing semicircular motion, moving the head in pendular movements from side to side. Move head in half circles. Begin by lowering the head toward the sternum. Move the chin toward the top of one shoulder, then lower the chin to the breastbone and move to the opposite shoulder. Extend the head backward by contracting the extensor muscles. Assist at the end of the movement with the hands, under the outer borders of the jaw or on the forehead. Do not extend spinal areas below the neck. Stretch the flexor muscles, release to a neutral position, and repeat. For those with disc involvement or following whiplash or severe trauma, hyperextension is more appropriately performed in a prone position. As you begin, tuck the chin as close to the neck as possible. Assist terminal movement with hands on the back of the head. Release and return to a neutral position. Do not allow the spinal areas below the neck to bend downward as the head moves forward. To stretch the lateral muscles on the side of the neck, contract the same cervical lateral flexors on the opposite side of the neck. Move head to the side that you are stretching, and at the end of movement, assist with the hand placed on the side of the head. Focus on an object directly in front of the eyes to prevent movement out of the correct frontal plane. Stretch and return to a neutral position. Rotate the head at 45 degrees to the left. Then move the head at a 45-degree angle towards the right breast by contracting the right side sternocleidomastoid and prevertebral muscles. Assist the movement with the right hand. Do the same thing when going to the left side. Rotate the head at a 45-degree angle to the right, then move the head downward at a 45-degree angle to the left, assisting with the left hand. To strengthen these muscles, rotate the head 45 degrees, then extend backwards at a 45-degree angle. Move the head towards the ear at the outer border of the scapula in the direction the head is rotated. Assist the movement gently with the same sized hand. Return to a neutral position and rotate the head in the opposite direction and move the ear toward the outer shoulder blade. Rotate the head to the left by contracting the opposite side cervical muscles. Assist at the end of the movement by placing the hand along the right side of the jaw and right hand on the left side of the head towards the back end. Avoid any compensation by shrugging shoulders or rotating the upper trunk. Move the head in half circles. Initiate the movement by lowering the head toward the chest. Move the chin towards the top of one shoulder, then bring it back down to the sternum and move it to the opposite shoulder. Repeat the sequence in the opposite direction. The exercise is performed in a 4-point position on the hands and knees or prone with the head extending beyond the edge of the table or bed. Initiate the exercise by lowering the head toward the surface, then extend the head upward as far as possible without extending the middle or thoracic lumbar spine. Assume a side-lying position and then move the head downward toward the lower shoulder and upward toward the top shoulder, giving a gentle stretch to the muscles at that point. In a side-lying position, this exercise is performed from a downward rotated position. Slowly rotate the head upward and to the right. Stretch gently at the top of the motion. The exercise is performed in a supine position. Retain the shoulders on the table throughout the exercise. Tuck the chin as close as possible to the neck. Lift the head as far as possible in a close tuck. You may provide aid at any point throughout the range or at the end of movement with gentle assistance with your hands.